So Dr. Sallman, perhaps you can tell us a little bit more about transplantation. What is it, and who should we consider for treatment?
Bone marrow transplantation is our only curative treatment. And really there's two different terms which I think are important to better define. We have what is called bone marrow transplantation or hematopoietic stem cell transplantation. These are basically the same concept. So bone marrow, we're truly taking somebody's bone marrow and we're giving that to a patient. But really the most common way we do this now is we collect their stem cells. And so if I'm going to be your donor, I take an injection that helps increase my white blood cell count, particularly my stem cells. I have an IV in my arm and they basically collect a certain number of stem cells, and then basically that is given to you, and the process is actually easy. It's really like a transfusion. The reason why we do this is my immune system will view all of your leukemia cells as different. And so the only way to really completely eradicate the disease is to get somebody else's immune system. Also, there are two different types of transplant. Again, allogeneic means you're getting a transplant from another person versus, let's say, autologous would be stem cells from your own self. Again, because your disease is smart, it's been able to avoid your immune system, again, where your immune system can no longer take care of the disease, whereas an allogeneic or somebody else's immune system, again, really has this high specificity to really eradicate every last leukemia cell. And so overall, our goal is to sort of clear out everything that's there, and then really going forward, you would have a completely new immune system, ideally for forever.